Coming up, we'll be on location at the Olney Center for Oral and Maxillofacial Surgery, discussing the latest advances in dental implants and how they can successfully restore your teeth, improve your oral health, and give you the beautiful smile you've always desired with one of this area's top oral surgeons, Dr. Tebyanian. Welcome, Dr. Tebyanian. It's a pleasure to have you today on the Top Doctors Interviews program.
Thank you very much for having me. My pleasure being here with you.
All right. We're really excited about, there's so much to talk about. There's so many advances in the oral surgery specialty, a lot of great new technologies as well. But I'd like to start off by talking about dental implants because there's so many people that are missing a tooth or teeth and need dental implants. So we wanted to find out exactly what are dental implants for those that don't know.
Dental implants are basically a permanent solution for replacing a missing tooth or failing tooth or teeth. They are based out of titanium for the most part, and the newer version of the dental implants are also based of zirconia or ceramic. These implants will integrate in the jawbone and become basically the new root or the foundation of a new tooth, so that a tooth will be permanently replaced, just like a natural tooth.
So what are the patient benefits, Dr. Tebyanian, from getting dental implants as opposed to other options such as dentures?
Well, dentures or partial dentures were available when there were no dental implants. The problem with dentures or partial dentures or bridges is that they are not really permanent. They can cause damage to adjacent teeth. They have to prep the other teeth to be able to place the bridge. And the partial dentures or dentures, they always move. They can never be stable. They always make noise during chewing or during talking, and you can never have a full function as a natural teeth on them. But with dental implants, this is a permanent replacement that feels and functions just like a natural tooth. And you do not touch the adjacent teeth to prep them for a bridge this time. You just deal with that one tooth, that spot, or the teeth that are missing. So result is much more predictable, much longer lasting if properly maintained. And the closest to natural teeth are these dental implants.
So it's basically like getting your natural teeth back. I mean, there's no better option than that. And as far as maintenance goes, they last just like your normal natural tooth would last. Is that correct?
They can last for many, many years. As a matter of fact, they can last forever if they are properly maintained. Maintenance means that patients have to take good care of them the same way they take good care of their other teeth. So they have to take their visits to their dentist for follow-up, for checkups, and they have to keep a very good and thorough oral hygiene. If all of these are checked, these teeth can last forever.
That's wonderful to know. And again, it's just like you would have to with your natural teeth.
Yes, absolutely.
So who would you say, Dr. Tebyanian, is a good candidate for dental implants?
Dental implants, I can say 98% of patients can be, 98 to even 99% or majority of patients can be candidate for dental implants. Very rare systemic diseases that are out there that are prevent placement of dental implants. For the most part, even people who have lost jawbone that previously would not be able to dental implant now can, because of the different technology and different surgical techniques that are available to bring bone back to life, just as if it was there to begin with. And dental implants need a good solid foundation of bone to be able to be solid and successful. So a good bone will lead to a successful implant, and it's all possible now. And most of the patients out there can have benefit of this treatment these days. with all these new technologies and the new products that are available in bone regeneration and the quality of the implants. They are much better than they used to. They are more researched on the surface of the implants, how they fuse to the bone. And for the most part, the stability of the success of the implant is much, much higher now.
That's great. The technology, the advances in dental implants have come so far that it really takes it to another level. It's like, again, having your natural tooth back. Are there any age restrictions, Dr. Tebyanian, for patients, minimum age or?
The minimum age is the age that the patients are done with growing. They cannot be in growth phase of their life. So whether it's 17, 18, or 19, or 20, that is the minimum age requirement. So patients who are missing teeth in their teenage years, whether from accident or congenitally, they have to wait till they are done with growth. But other than that, there is no up limit as far as the overall health and the medical health will allow. Patients can have dental implants and replace teeth.
Well, that's great to know. So now what's the patient process to get dental implants from when a patient will call you? What will they go through?
The first visit is always the consultation visits. That's the visits that I review the dental history, the medical history, the x-rays. Sometimes we need to have a CT scan to have a three-dimension view of how much bone or the quality of the bone that we are working with. Sometimes we are able to do a dental extraction and place a dental implant same time if there are certain criteria that we need to have is all met. The first part of the process is by consultation. In the consultation visit, we will do a medical history and a dental history, and we will do the clinical exam and we review the imaging or x-ray or CT scans. After that, we will book the patient for the surgery. During the surgery, the actual procedure will be performed, whether it's the placement of the dental implant or it's bone grafting for placement of dental implants in future, that will be done. And usually there is a 2-3 months of recovery after placement of the dental implant, and that is necessary time for bone and implants to fuse together, so that they are a solid foundation for placement of the crown or actual tooth part of the dental implants.
So Dr. Tebyanian, what kind of results have your patients been seeing from the dental implant procedures?
They see great results. These dental implants are very predictable, and typically after placement of the dental implant and the healing period that is required, we will test the dental implant to make sure they are taken and the gum tissue and the bone tissue around the dental implants are solid. And then we will send them back to their restorative dentist. After the crowns are placed on these dental implants, it will function and feels just like natural teeth. And the patients are very pleased.
That's wonderful. So they're getting not only their great smiles back, they're getting the restorative functions as well to be able to eat the foods that they always wanted. You can go out and have that steak again. Really gives your quality of life back to you.
Yes, it will restore the confidence and the function. You can eat pretty much everything you want. And remember, the process of digestion starts with act of chewing, and proper chewing will let you absorb better nutrients. So it will affect your health even indirectly by being able to chew the foods that you are eating, not just enjoying them, but absorb the nutrients that your body needs for proper health.
During the pandemic, I had problems. I broke a tooth, and I came to him, and he did an extraction for me. And then I started doing the research about the implant, and I decided that he could do an implant for me. Oh, it was so easy. He has such a nice staff. He is very, very gently and soft-spoken. You can understand everything what he said and how he's gonna do it, and I was very pleased with that. I'm very happy about it because I never experienced any pain. He gave me a lot of antibiotics and I was fine. I never had any problems with it. And he gave me pain medication that I didn't even use because I didn't need it. I didn't take it. So I didn't even get swollen. I was surprised. I was expecting to get all swollen. I didn't get anything like that. So I'm very happy about the treatment. His staff is really nice. He is very nice, I mean, easy to approach. He can explain everything to you, and it's no problem when you start getting the treatment. You don't get nervous or anything like that because he is very gently doing the stuff. That's what I would recommend him. He is such a nice person.
Last year or so, I've been having toothache. So I had to have an extraction. And then I had to have another 2 extractions. And I didn't have many teeth. I was losing them too fast because I didn't have the kind of care that I should have had throughout most of my life. I'm a senior, proud of my gray hair. And my husband used to take me. I do better than some of my neighbors who don't drive outside of their zip code. But my husband used to take me. He passed away. And so I was looking for a dentist and a dental surgeon who were close to each other, so once I got accustomed to where I had to go, it would be no problem. So I came to a dentist in this building, and I was impressed by that office because of all the new technology I could see in use and on display there. And he recommended Dr. Tebyanian to do my extractions. But I realized that very soon I would not be able to enjoy all the foods I loved. So I spoke to him about it, and I went back to my dentist and spoke to him. I was very impressed with him, and I was very impressed with Dr. Tebyanian. I have never known another dental surgeon who is a MD in dental surgery and an ND too. And I've been affiliated with the medical field, so I am very impressed with people who keep up with changes and keep improving themselves. So, and then I had him start some work on my mouth, and what gave me even more confidence is the fact that he made time to call me at home and follow up with my treatment and the processes that he was doing for me. Well, it's not quite finished yet, but so far, so good. I would recommend him because he is very detail-oriented. He's concerned about not only Dr. Tebyanian, but the people in the office. They're very concerned with your welfare. I know I called one time and I was worried. At my age, I was kind of worried about how I would deal with these different processes. Would I have complications? And he called me and talked to me. I had already talked to my doctor, my primary care, and my primary care said, I was always told, don't do these procedures except you have a hospital backup. So I was happy that everything was right here on the hospital compound. And he took his time to talk to me and explain everything and what I would go through. He gave me everything I needed to be safe. Medical medicines, antibiotics, proper mouthwashes following the surgery, painkillers, and everything. And plus, he kept calling, following up. I have not always found that to be so here. So I was pleased and I was put at ease.
What other procedures do you offer here at your practice, Doctor?
We offer a full scope of oral and maxillofacial surgery. Our routine procedures are dental extractions and placement of dental implants and all necessary treatments that are required to be done to be able to get to dental implants. For instance, some patients do not have enough bone in their jaw and they need augmentation of their jawbone to be able to get dental implants. We do offer treatments of TMJ disorders. We do offer oral maxillofacial region pathology, cysts or tumors that are associated with the mouth and jaw or face. We do offer treatment for dental facial deformity or orthodontic surgery, jaw surgery for misalignments of the jaw and the teeth. And also we offer facial rejuvenation or facial cosmetic treatment for our patient as well.
That's wonderful. So you really offer the full spectrum of oral surgery procedures that are out there. You have cutting edge technology here at your practice. Your patients love you. We saw some of their testimonials earlier as well. You're doing great work in the community, Dr. Tebyanian. You're recognized as one of the top oral surgeons in the region. And I wanted to ask you what you feel separates you and your practice from a lot of the other practices in the community.
I can say attention to detail and treating every single patient just like our family. From the second the patient calls our office to when their treatments are completely finished, we will make sure that they are treated just like family. And because of that, we pay attention to every single detail that involve in their treatment.
That's really to the patient's benefit. It's like you look at it as a true partnership, like a family member. You take the time with each patient that's necessary to really understand what their goals are, what their needs are, and you're providing great outcomes for the patients as well. And on that note, I want to thank you, Dr. Tebyanian, for being a guest today on our program, and we look forward to having you back.
Thank you very much. It was an honor being here.